Milestone reached today in the number of coronavirus cases in the U.S. And to discuss it with us is Dr. Rick Malley in the Division of Infectious Diseases at Boston Children's Hospital. Thanks for being with us today.
My pleasure.
So we've now exceeded 4 million cases of COVID-19 in the U.S. It took only 2 weeks to add on that last million new cases. What are your concerns about how quickly these case numbers are surging?
Well, unfortunately, with this type of epidemic that we're suffering through right now, once you start seeing an increase in cases, it tends to continue exponentially unless you enact very strict measures. And so once you start seeing an increase in cases, it's unfortunately not surprising that the rate of rise is as fast as what we're observing now.
So let's talk a little bit about Massachusetts then and break that down. We've been looking at the data. It shows since June 1st, there's been a really noticeable increase in cases in that 20 to 29 age group. Cases for under 19 also growing at a faster rate. What could explain that change from seeing the bulk of cases in that older age group?
Well, in a way, I think what's happening, unfortunately, is that there's a certain segment of the population that is probably highly mobile and is interacting very much with one another, and those tend to be the youngest, healthiest population. And so you start seeing an increase in cases, particularly in the population that is the most mobile, the most social, and perhaps the one that is maybe less inclined to use the very important measures that we know work, such as wearing masks, physical distancing, washing your hands, and really trying to stay outdoors much more than going indoors. In contrast, people who are at much higher risk of severe complications from the disease are probably using the important precautions that I just mentioned, and therefore you're seeing a rise in the young population and less in the older population. The problem with this, of course, is that as the virus density increases in the population, even those who are more vulnerable and are being more cautious, perhaps, can still acquire the virus by contact with individuals who are younger and more mobile.
Right, always the concern. Dr. Malley, I want to get your take finally on state education officials releasing new guidance for schools today. So they're talking in changes about how to circulate air, staggering recess times, no use of lockers, meal times in classrooms. Is this a good formula to get kids back in the classroom, or do you think that more needs to happen?
I think it's a very important step in trying to get kids back to school. And I know from talking to parents that many people are worried about sending their kids back to school, but we all recognize that it's very important to try to get schools and kids back in schools safely in the fall. So I think these are important measures. What we will need to do, of course, and every parent and every official is going to be looking at this in every district, is to keep a very close eye on the numbers of cases and the rise in numbers of cases in any community, and also making sure that the schools that the children are in fact following those guidelines. Should any of these variables change, for example, a rapid rise in cases in one community, then I think people will have to be very careful and maybe revisit some of these recommendations.
It's a good reminder that the data is just so fluid. All right, Dr. Rick Malley, Boston Children's Hospital, thank you so much for your time. We appreciate it.